today, Grace Egan. Grace is the Manager of Business Development for Language Services at Access Alliance Multicultural Health and Community Services. Grace joined Access Alliance in 2014, moving from University Health Network, where she held various positions in interpretation and translation services, including staff interpreter, clinical educator, project coordinator, and acting manager. Grace served on the Board of Directors of Healthcare Interpretation Network and is currently on the board of the Ontario Council of Community Interpreting. Her research interests include obtaining informed consent across language barriers, interpreting verbal pain expressions from Italian to English, and leveraging technology in translation. Thank you very much for joining us today, Grace. Please go ahead with your presentation.
Well, thank you, Sarah and Lorraine, and thank you everyone for sharing an hour of your day to learn about working effectively with interpreters. So I am just going to jump right in, and just waiting to advance my slide here. There we go. So what we're going to walk through today is we're just going to give a quick slide sharing some basic information about common terminology, and then letting you know about Access Alliance Language Services, what we're talking about when we say health equity through language support. We'll talk a little bit about just what are some of the consequences when we don't provide language support when there is a language barrier. Language screening, which is finding out about what is the preferred language that our clients prefer to use when working with English-speaking service providers. And then when do we need an interpreter and who is qualified to interpret? And then after we've covered that, what we'll do is walk through a few slides about some hot tips for working effectively with interpreters, and then just some of the ways that you can access language support and interpretation services at your agencies. So to start off, we had a question before when people were registering about what is the difference between interpretation and translation. So this is a great place to start. When we talk about interpretation, this is the oral rendering of a message from one language to another. And what we say, it's rendering a message as faithfully as possible from one language to another. And this can be done through a couple of different modalities. The two that are the most common for us are on-site, or we also call it face-to-face, and that's when everyone is physically present in the room, or remote, and this can be done either over the phone or by video. And even the phone can have a couple of different scenarios, so everyone can be present in the room together except the interpreter, and the interpreter is a voice on the phone. Or it could even be a three-way conference call. So if, for example, you needed to follow up with a client at home just to touch base after a meeting, or even a patient or client reminder, appointment reminder call, you can just do that by having a three-way call between you, your client at home, and the interpreter who's working remotely. Now, when we talk about consecutive interpretation, this is when one speaker says something in a language, then the interpreter interprets, and then the client has a chance to respond. And so it's a lot of turn taking. One person speaks at a time and everyone just takes turns. So that's consecutive. Simultaneous interpretation is typically what we see, maybe if you're thinking about a big presentation at the UN and interpreters are in booths and they're really only a couple of words behind the speaker. And so it's not exactly simultaneous, but it's pretty close to simultaneous. Now, when we talk about translation, that is going from written to written. So just translating a document from one language to another. Where it can get a little bit confusing is when we talk about sight translation, because that is just as the image shows, so it's the same image as we see up above for the interpretation. And so that's when an interpreter is looking at a document in one language in front of them, and they've had time to prepare. It's always a really good idea to give the interpreter some time to prepare a document before doing a sight translation. And so they are looking at the document and then rendering the written message verbally in another language pretty much as they're reading through the text in front of them. So that's sight translation. So just to recap, we've got interpretation, translation, and sight translation. Now, when we talk about community interpreting, there are a few different types of interpreters, and they all have different skill sets and in different contexts. So we have court interpreters, conference interpreters, and then a more general term called community interpreting. And this is pretty much the interpretation that takes place for public service sector encounters. So it could be anything from at a legal clinic, banking, or in healthcare, just whatever we would consider to be public services. Now, when we talk about ad hoc versus professional, a professional interpreter or qualified interpreter is an interpreter who has gone through training and testing and has met some other standardized qualifications, and they are paid to interpret. When we say ad hoc, this is not really even someone who carries the title of capital I interpreter, but it is someone who is providing interpretation, but typically it's someone who is untrained and untested and whose role is not specifically intended to be solely interpreting. Okay. Just to give you some background about Access Alliance, we are a multi-service nonprofit agency. Our client focus is immigrants, refugees, and other newcomers at risk. And most recently in our new strat plan, we've expanded that to be and the communities that they live in, because it's really important for us to recognize a bigger picture about the communities that that client base is living in. And so Access Alliance Language Services is a revenue generating program within the agency. And so what we provide is interpretation, translation, and also training like we're doing today on best practices for working with interpreters. When we talk about health equity through language support, so language is high up on the list of the social determinants of health, and it's one of the main barriers to accessing healthcare, receiving good quality healthcare, and for individuals to achieve their desired outcomes and their health potentials. And so a sentence that we think is really important for all of us to be using is that language access initiatives are in place to ensure that all individuals have equitable access to high quality care regardless of the language that they speak or sign. And so we would love to see that used in messaging across all of our agencies. And when we, I mean, a lot of us do understand the importance about providing language support, but if there are some of you out there who are still presenting a business case for a language access plan or having interpretation services in place and ready to use, especially in healthcare, here are some points that we can point to, and if you're looking for any research that supports this, reach out and we can send along some of the publications that support this list. So when there is a language barrier and qualified interpretation is not provided, these are the consequences that we see. We see an increased use of emergency services, and this is a pretty simple one. There's a lot of there are a lot of community clinics or even private practitioners who do not have language support in place. And so as hospitals are increasingly installing access to over-the-phone interpreting or other types of interpretation, individuals know that they will be able to communicate when they go to the emergency department. And in other cases, situations have just reached an urgent point and individuals have to go to emergency to receive care. There is unnecessary imaging and interventions that are being done. That's usually because effective communication was not achieved when getting a patient's history. We see increased hospital admissions and increased length of stay. It may not seem like a lot, but there was a research study done at UHN in the late 2000s that showed that the average length of stay was a whole half day longer when there was an unaddressed language barrier. And so that really adds up. And it's also more taxing on the individual. We see increased readmissions within 30 days of discharge. there's an increased risk of adverse medication and drug events, and there's an increased burden of disease. Now, this is this is a tough one to quantify, but it really is that let's think about individuals who may not have access to supportive cancer care after they're diagnosed with cancer because the information isn't shared with them, that there are support groups out there, or even that the support groups can't provide language support. And so individuals facing language barriers aren't as likely to reach out for supportive care. So that's what that one is all about. And then overall, as a systemic issue, we do see an increased overall cost of care just because of all of these other points above it. And then for those of you who are maybe in settlement and helping individuals navigate the system when they first arrive, it's important for us to remember about the healthy immigrant effect, and that is that there is a tendency, a marked tendency, for an individual's overall health to decline after they have immigrated. And so the unaddressed language barriers and other social determinants of health are definitely a part of the healthy immigrant effect. So now when we talk about, do we need an interpreter, we've underscored we because it's not just the individual with limited English who needs the interpreter, but it's also us as the English-speaking service providers who need the interpreter because we don't speak our client's language. So we just prefer to have the question as, do we need an interpreter? So the next 3 slides are looking at 3 different ways of asking this question and determining the need for an interpreter. So the first one comes from some work that was done by us, the Institute of Medicine, and they developed a preferred language screening. And so their recommendation is to ask 2 different questions. And the way that they've come at it is they ask first, how would you rate your ability to speak and understand English? And then what they are saying is that if someone answers anything other than very well, that determines limited English that, especially in healthcare, requires the utilization of a professional interpreter. So what is also recommended as part of this is that if the answer is anything very well, then the demographic data has to have a collection mechanism so that you can capture preferred language. And then the follow-up question to that is, what language do you feel most comfortable using when speaking with your nurse or doctor? So rather, you might have some other questions that follow up about asking, what is your first language, or what language do you speak at home? But what they're saying is, if you have only the capacity for 2 questions, these are the ones that they recommend. Another way to look at it about, do we need an interpreter, is to consider the consequences of not having effective communication for the different types of conversations that you're having in the services that you deliver. So if we sort of considered a spectrum of conversations, on the one side, you might have something that is completing a form for a non-clinical program. Now, of course, completing a form for summer camp, there are permissions involved, and so that has its own, I'm opening up a can of worms there, but let's just imagine it's completing a form for a recreation program. And then on the other side of the spectrum, it gets a little bit heavier, and there might be a conversation that's discussing diagnosis and treatment options, and then we get into informed consent and talking about risks and benefits of an intervention. So while in your own organizations you may not have a policy that defines a point at which you need an interpreter, it comes down to making a decision pretty much every day. And in all of the conversations that you might be having, just weighing this idea of a spectrum and what is the consequence if there's any compromise to effective communication. And then a third way of coming at it if you're creating sort of a decision matrix, this is another piece of research that came out of the US a little more recently. And this group identified 5 high-risk clinical scenarios that require qualified interpreters. So they're saying that if the conversation or the intervention has anything to do with emergency department care, obtaining informed consent, surgical care, medication reconciliation, or discharging a patient, you ought to be working with a qualified interpreter. So when we start talking about, before we get to who is qualified, we're going to talk a little bit about why we shouldn't be using ad hoc interpreters. And so the first group of ad hoc interpreters are family and friends. So first of all, we don't have a proof of proficiency necessarily in both languages. And also family and friends tend to have a lack of knowledge and definitely training to competently interpret medical procedures and concepts. We also know that this group of ad hoc interpreters is less likely to ask for clarification. It might seem counterintuitive to feel confident when a professional interpreter is stopping to ask for clarification or saying that they don't understand a term, but it is actually the responsible thing to do. And interpreters are actually encouraged and trained to interrupt and ask for clarification whenever they are not 100% sure about what they're about to interpret. So again, back to the slide, family and friends tend to not ask for clarification as much. There is definitely, or at least a very strong risk of a violation of client privacy or confidentiality. We often talk about, and we almost ad nauseum about some examples, like when a child is asked to interpret and suddenly the doctor or the physician has to ask about something that might be related to sexual activity and or some other kind of personal question, and it's just not appropriate. There are definitely conflicts of interest and burnout. Family might have one intention for the individual, and if they're interpreting, then we're compromising hearing that individual's voice directly. And then on the flip side of it, when we talk about burnout, it's a very mentally taxing act to interpret. And so if you've got family or friends who are really supposed to be there to be providing support and just be able to be strong for when that individual leaves and goes home and have other sort of supportive activities, asking them to interpret is actually asking them to take on another role, and you're risking burnout. Now, there is a tendency to significantly filter information and introduce a certain bias in the communication. And just like the next point, it often comes from a good place, a good intention, often to protect the family member or the friend, to filter information and maybe not give the whole picture, or to soften the blow of bad news. But it's just not appropriate for us to have someone else filtering that information. And then another group of ad hoc interpreters is untrained bilingual staff. So if they're untrained bilingual staff, they aren't trained in interpreter competencies, so they haven't built up just the knowledge and the skills about maintaining role boundaries and not filtering, editing, summarizing, and how. So that's just to touch on some of the competencies, but they're not trained in the competencies of interpreters. They're not tested for language proficiency in both languages. And once again, we see a potential violation of client privacy, and that's linked to this next point about role confusion for the client. So if an individual in a certain role has had an interaction with a client and now suddenly they're there as interpreter for a different service provider, it can be very confusing for the client, and that shifting role boundary and being a part of a conversation that might not be something that that individual would otherwise be privy to, it just gets very murky and it's best to avoid. And then when they are interpreting, the quality of the interpretation and their accountability as an interpreter is just, it's questionable because it's outside the scope of the role that they have been hired to do. And then finally, from a risk management point of view, the role or the participation of an untrained bilingual staff as an interpreter is often not documented. So it's increasingly we're seeing a requirement that the use of language support be documented in, especially when we're talking about health encounters. So if say there were an adverse event and it was traced back to a communication error, and you know that it was an individual with limited English, if it was an untrained bilingual staff member who was there interpreting, it's less likely to have been documented in the chart, so it might actually look like there was no interpretation provided. So for various reasons, it's a recommendation to avoid using untrained bilingual staff as interpreters. Oh, I forgot about this last one. So, and once again, just like on the other slide, we see that there are conflicts of interest and potential burnout, because it's a lot to ask a staff member to take time out of their day to interpret. Then the work that they're supposed to be doing starts piling up. And then the conflict of interest side, imagine that you've got a nurse practitioner who is asked to interpret for another nurse practitioner. What do you do if they would be in that moment, if they would have different recommendations for a course of action or treatment? It's a conversation that would be had maybe in a case management review, but in the moment, there's definitely potentially a conflict of interest. Now, when we talk about qualified interpreters, there are testing and training requirements. And so right now, there is a 180-hour college training that is pretty much becoming the gold standard for community interpreters in Ontario. And then there are also some recognized community-based delivered programs that can range between anywhere from 70 to about 140 hours. So the range right now of the generally accepted recognized trainings go from 70 to 180 hours. And then interpreters are also required to pass a standardized skills assessment test, and these are generally the two that are most recognized right now are the CILSAT and the ILSAT. And most agencies will require a test for any language pair that an interpreter is working in. And then beyond that, when we talk about accrediting bodies, so these are the organizations that are allowed to use the terms either certified interpreter or accredited interpreter. So either accrediting bodies and hiring agencies often go a step further, and they will require ongoing professional development, post-secondary education, proof of a minimum required level of English proficiency, police background checks, and confidentiality agreements. Now, confidentiality is definitely one of the standards of practice and part of the code of ethics of interpreters, but often interpreters will be asked to sign individual confidentiality agreements for the agencies that we're working with, and sometimes even for specific individual encounters. So they are bound to maintain privacy and confidentiality for any information about an assignment, and then anything that they see or hear while on an assignment. So we were also asked when people were registering to provide sort of a case scenario or an example. So here is a transcript of a short exchange that was interpreted by an untrained bilingual individual. So we'll just take a look here and see what happens. So in this case, the clinician asks, what kind of moods have you been in recently? Then the interpreter interprets something, the client responds, and then the interpreter interprets back into English for the clinician. She says that she feels fine, no problems. So then the clinician, feeling that that was a reasonable answer to the question of what kinds of moods have you been in recently, the clinician continues in English. Do you still feel sad? Do you feel that life is not worthwhile sometimes? Then the interpreter interprets that to the client, responds, and then the interpreter interprets that back into English for the clinician, saying, she says that no. She says loves her family and that her family need her. So now, after this was transcribed and translated by a professional, we see the following. So the clinician asked, what kind of moods have you been in recently? And the interpreter asks, how have you been feeling? So right here we see that the specificity of the question about moods has been lost, and we see a more generic way of asking, how have you been feeling? Then the client responds to that question, going in a different direction, interpreting that question in a different way other than moods and a little more physical, and answers, no, I don't have any more pain. My stomach is fine now, and I can eat much better since taking the medication. So clearly a few points there that are definitely indicating that the client is responding to the question having thought that it was about how are you feeling physically. So then what the interpreter interprets back into English is she says that she feels fine, no problems. So if at any point the interpreter had interpreted more faithfully and had hit any of the points of the words of pain, stomach, eating, medication, maybe the clinician would have clued in, because at this point, having heard in English only, she says that she feels fine, no problems, the clinician continues thinking that that's a reasonable answer to the question of what kind of moods have you been in recently, and so then asks, do you still feel sad? Do you feel that life is not worthwhile sometimes? Now, when that gets interpreted to the client, it's the equivalent of the doctor wants to know if you feel sad and if you like your life. Now, we can nitpick all of this and get into a whole bunch of specifics, but what I want to point out here is the still is gone. So it's, instead of asking, do you still feel sad? It was interpreted as the doctor wants to know if you feel sad. And so potentially there is the reference to the past relationship or the past reference of being sad, and that's gone. And so we don't know what kind of impact this would have on a client, because without that overt reference to a potential continuity of this, of the feeling sad, could this mean that the client thinks that the clinician doesn't have notes on it, doesn't remember, or it's not significant anymore? And then there's a really big difference between, do you feel that life is not worthwhile sometimes, to if you like your life. So hearing that question, the client answers, no, yes. I know my family need me, so I cannot give up. I try not to think about it. So here, it might seem small, but even what we see here when it goes to the English, the no, yes is gone, because it's rendered as she says that no, she loves her family and that her family need her. So starting off here, no, yes, so that that sort of flip of the decision or the contemplation is gone, and we lose completely, so I cannot give up, and I try not to think about it. So all of that is lost, and it's just not provided to the clinician. So this was just to give you a snapshot of all of the nuances that can be lost, and just how important it is to work with an interpreter who sticks as faithfully as possible to what is said, just because so much of it is clinically relevant. So now to jump into just some tips for working effectively with interpreters. Before the encounter, as we talked about before about preferred language screening, ask the client for their preferred language, and even make note if there is a dialect, because if it's great if you can ask for it, and great if whoever the agency is or whoever's providing the interpretation can meet that specific dialect need. But let's at least find out what it is and ask for it, and try to get the best, most appropriate language match that we can. And when you're scheduling, just remember that it can take almost double the amount of time in an encounter when an interpreter is there. It is absolutely worth it. It's what is needed for effective communication. So let's just manage expectations, know about it ahead of time, and just plan for it. If you're working with over-the-phone interpreters, do what you can before the encounter to minimize any ambient or background noise. And then when the interpreter is there, just before the encounter begins, just brief the interpreter, especially if it's an over-the-phone interpreter, because they won't have eyes in the room. So just in 1 or 2 sentences, let them know the context or what is about to happen. It's sometimes enough to just say, hi interpreter, I'm meeting with a client for the first time and I'm just looking to get a patient history, or interpreter, this is a follow-up assessment after the individual's first visit to the diabetes clinic. Just something like that, 1 or 2 sentences, and it just gives the interpreter a chance to just get focused and ready for that particular assignment. Then, when you're ready to go, allow the interpreter to introduce him or herself in both languages. This is a really important step, and there are a couple of points the interpreter will mention about speaking directly to each other, speaking in 1 or 2 sentences at a time, reminding everyone that if they have to stop to ask for clarification or repetition, they'll do a little hand symbol so everyone will know that that's what the interpreter is about to do. And then a key piece is just reminding everyone and reassuring that everything heard and seen will remain confidential. So during the encounter, really key is to never leave the interpreter alone with the client. So the interpreter is there to support your conversation with your client. So if you're not there, then there's no need for the interpreter to be there. Speak directly to the client. So you're not asking to the interpreter, please ask her how she's feeling. You're looking directly at your client and you're saying, how are you feeling? Speak at an even, normal pace. Just not too quickly, not really, really slow, just nice and normal. And then speak in short sentences and allow for turn taking. So this goes back to consecutive interpreting. So one person speaks, the interpreter interprets, the other person speaks, the interpreter interprets, just one at a time. And then speak in plain language. So you can't expect the interpreter to change the register. So going from complicated medical speak down to plain language, that's not something that the interpreter should be doing. So just speak in the register that you would use if the client spoke English. And again, we're repeating to never leave the interpreter alone with a client. It is so important. Another aspect of it is that people people tend to want to speak with the person who shares a language. And when the interpreter is there, they're not there to engage in a personal way with the client. So let's just avoid that tendency altogether. If you leave the room, the interpreter gets up and leaves with you. And remember that everything that is said while the interpreter is present will be interpreted. So just don't have any side conversations. And here's one that isn't always super clear, and it's up to you as the service provider to check in with the client for understanding. It's not for the interpreter to make an assessment about whether the client understands. So just as you would with an English speaking or a client who shares a language with you, you would ask questions like, is this all making sense? Do you understand this? How about you repeat back to me what you think the instructions are? So it's your responsibility to make sure that your message is being understood by the client. So you're the one who has to check in with the client for understanding. And this one is respect and expect the interpreter's role boundaries. So just as you can expect the interpreter to interpret everything that you're saying as faithfully as possible, to maintain confidentiality, and just to perform in a professional way. We also ask that you respect the interpreter's role boundaries, so it's not appropriate to have the interpreter hold a client's baby or to grab some medication off of a shelf. So just, it goes both ways about the interpreter's role boundaries. And then being conscious of the book time. So interpreters are often working as independent freelance contract interpreters, and they might have to get to the other side of the city within 45 minutes of the end of the book time. So it's really important as much as possible just be conscious of the time that you've booked the interpreter for. So if we just sum it up quickly, we would say the top tips for working effectively with interpreters are: brief the interpreter, allow for the interpreter's introduction in both languages, speak directly to the client, speak at an even pace, speak in just 1 or 2 sentences at a time, and check in with the client for comprehension, and then write down that you used an interpreter. So whether you're capturing the interpreter's name or their ID number, just write it down and keep it documented. And so if those were the top tips for working effectively with interpreters, just one level sort of up higher, if we're talking about the basics of language access, you want to be capturing preferred language. And so when we say A for ask about preferred language, we also want you to consider to actively offer language support and address any concerns that an individual might have about working with an interpreter. B for book an interpreter, or at least make sure that your agency or you have access to appropriate and qualified language support. And then C is for charting or documenting that language support was utilized. The more that we can document this and keep track of it, then we have a better way of actually measuring the demand and the need for language access across our agencies. So there were some questions too about how to access either free or cost-effective interpretation services. So one resource that is good to know about is the Language Interpreter Services. Now this is a government-funded program, and so all service providers who work with victims of domestic violence, sexual violence, or human trafficking are eligible to access language interpreters on behalf of their clients. So you can follow that link. And then just as a recommendation for anyone who is looking to contract with an interpretation service provider, look for an agency that's certified. There are a couple of certifying bodies, and they follow ISO standards. And then also adhering to the National Standard Guide on Community Interpreting Services. So you can follow the link here that will take you to the OCCI that now hosts the publication of that National Standard Guide. Another thing that can be done, many hospitals and CHCs have their own language access plans. So if you are referring your clients to hospitals or other health service providers, ask that hospital or the HSP about their access to interpretation services and then share that with your clients. And then another thing that we can all do is supporting our clients to advocate for themselves. So the link here is to a brochure called the Working with Your Professional Interpreter Guide. And it is a brochure that was developed in English and then translated into 15 languages, answering questions that individuals with limited English might have about what is an interpreter, what can I expect of them, what is their role. And then there was one piece that was left in English in all of the translations, and it pretty much says, I understand the role of the interpreter, and I wish to have one at my next appointment. So it is pretty focused on interpreting in healthcare, but it's a pretty good tool to help individuals as they're navigating all the public service sector system on how to say that, hey, I would like to be working with an interpreter. It doesn't guarantee the access, but at least it's an advocacy piece that we can all support. So that is it. And those links will be on the PDF of the slide deck. So I'll hand it back now to Lorraine and Sarah, and thanks everyone for listening.
Thank you very much, Grace. That was an excellent presentation. We look forward to questions from the audience now. So as Sarah explained at the beginning, you can either raise your hand using that icon and we'll unmute you for you to speak, or you can type your questions in the box at the bottom of the control panel. Okay, I don't see any questions coming in yet, but we'll give people a little more time. Grace is very happy to answer your questions if you do have any.
Definitely, I'm here for a bit.
Although you did really provide a lot of great information. And yeah, I think people learned a lot from your presentation. I did as well.
Super.
I'm just wondering, in addition to questions, if anyone is interested in sharing any of their experiences working either with professional or ad hoc interpreters, you'd be welcome to share that as well.
Oh, if I can jump in, there was one question that came in beforehand that I didn't explicitly address, and it was just if there was a question about that some agencies might have contracted with a particular interpretation service provider. And so I just want to say that it's a common practice right now for agencies, whether it's hospitals or other organizations, to contract with a single service provider. And so if you are referring clients to an organization that works with only one specific interpretation service provider, if there's ever a time that you really like working with their interpreters or have any feedback, then there should be a mechanism for providing any feedback that you might have. But it's often a really good thing when there is a preferred service provider, because they often look for locally sourced interpreters. So it can be a really good thing if they do have a preferred service provider.
Thank you, Grace. Okay, I do have a couple of comments that have come in. So one person is actually asking about the slides. So yes, we're going to post those after, and we'll send you the link in a follow-up email, so you'll be able to access the slides as well as the recording of this. And this, okay, a question says, I just wanted to clarify that interpreters always speak as first person. They do not say she, meaning the client says that. Is that correct, Grace?
That is definitely the best practice. That is how interpreters are trained. So that is something that you can expect as the way that the interpreter should be performing. And if you as a savvy consumer know to expect that, You're perfectly within your right during the encounter to just stop and say, interpreter, please interpret in the first person. And hopefully they'll know what you mean, and it might have just been a temporary slip, and they'll revert to working in the first person. It seems awkward at first, but it's what's expected of interpreters, and yes, they should be using the first person.
Okay, thank you. And actually, there's another comment on that same topic from someone who is a settlement worker and also does ad hoc interpretation, just looking for clarification on that. So we have the answer that first person is expected.
Mm-hmm.
Okay.
Yeah. The only time that it wouldn't be used would be if the interpreter was doing a sort of a timeout sign and interrupting, and in that case, the interpreter ought to be referring to themselves in the third person. So you would hear something like, the interpreter needs to ask for permission to clarify a question.
Okay. Thank you. That's helpful to know. Okay, we do have another question. It says, if we are concerned that someone is not interpreting exactly, how should we address it in the moment? And if this is a recurring issue, do we report to the coordinator of the services?
Yes and yes. So in the moment, so it's important to remember that this is your conversation with your client. So you are fully within your right. As soon as you get that weird little, that gut feeling, that spidey sense, whatever it is that's triggering for you, that you think things are not being, the messages are not being rendered faithfully, I would absolutely encourage you to stop it and say, interpreter, could you please clarify or repeat what the individual just said? Or interpreter, I'd like to ask my question again and have you interpret it again, please. And
Okay.
And if that doesn't rectify things, if you want to stop it and call it out in the moment for a specific thing that you think was not interpreted well, you can just say, interpreter, I asked the client a very short sentence or a very short question, but you seem to go on for quite a while. What was that about? And if it's not clarified if you still don't feel good about how it ended, I would definitely give feedback to whoever the coordinator is or whoever arranged for the interpreter to be there. It's really important. As a manager myself, I actually, you never want to hear about complaints, but they are valuable moments to be able to follow up with the interpreter, do some coaching. Sometimes it's even going back to the service provider and doing some coaching on working effectively with interpreters. So it's a good thing to let everybody know that things didn't go in a way that was satisfactory to you.
That's great. Thank you, Grace. And actually, there is a note of thanks here as well for bringing up the issue of dialects in your presentation. This person has heard of a lot of issues with that with clients in immigration court.
Yeah. So as much information as you can get about your client's preferred language or dialect, the better. Like I said, it doesn't guarantee that we can provide a perfect match, but set the bar as high as it needs to go, and we'll see what we can do. We definitely saw some challenges with the Syrian refugees and the language support that was required there, because there were a lot of different varieties of Arabic and even a couple of types of Kurdish. So we all learn as the demand increases.
Okay, thank you. And just a clarification about ad hoc interpreters. Does ad hoc interpreter mean volunteer interpreter?
So it pretty much means anyone who is untrained and untested and sort of pulled into the role of an interpreter. Now, it could be that someone is providing interpretation on a volunteer basis, that they've chosen to not get paid for it. But we prefer to not necessarily define it by compensation, but by training and testing.
Okay, thank you. Are there any more questions at this time? We have a thank you very much comment. Thank you very much, Grace.
Oh, well, thank you everyone for listening. It's great to know that there's interest in this.
Yeah, for sure. And I'm glad that we were able to record and can share this. There are a few people that emailed that couldn't make it. So thank you so much again, Grace, and to everyone who attended today's webinar and offered their lunch break. If you have any other questions, you can contact Grace at the contact information there. Or if you have questions about the Refugee Settlement Support Project that Lauren and I are working on, feel free to contact us at, and this is one word, refugee settlement at ocasi.org. That's REFUGEESETTLEMENT at ocasi.org. You'll receive a follow-up email, like I mentioned earlier, with the link to today's recording, as well as a copy of the slides, and it's for today's webinar, but there are also the recordings and slides from previous webinars on that page. And there will be a survey link as well in that email, and we would really appreciate it if you could take some time to complete that and provide your feedback to us. So on behalf of Okasi and Lorraine and I and Grace, thank you again for joining us today, and we hope that you have a wonderful day. Thank you. Bye.